In 1967, pharma hired its first medical science liaison. That was just the beginning. Upjohn's move to place medically trained voices in the field marked the birth of medical affairs. Since then, MA has ridden the swings of a pendulum between loosely regulated rules and tightly compliant, between proactive and reactive, between a service function and a true strategic partner. Now, in this current formulation of medical affairs, we are at the same time required to be reactive and compliant, but also be leaders in the sharing of science and the curation of insights. No other function combines scientific depth, stakeholder connection, and strategic perspective like medical affairs can. As therapies become more complex with precision medicine, gene therapies, stem cell treatments, ecosystems more regulated, and demands for evidence at an all-time high, even when the concept of scientific truth is threatened, medical affairs is uniquely positioned to lead with credibility.
To ensure your MA team makes that leap from support to strategic leader, contact LMA. Empower, engage, elevate.